Thank you for joining our webinar on improved delegated data sharing today. We'll be providing a demonstration of CAQH ProView for Groups, our new solution for delegated data sharing. Here's our agenda for today. First, we'll talk a bit about the challenges of sharing provider data. After that, we'll get into ProView for Groups itself, what it is, how it works, and how it makes your life easier. This will be the bulk of the discussion, and my coworker Taha will take us through a live demonstration. Finally, I'll tell you what you need to do to get started submitting rosters using CAQH ProView for Groups. ProView for Groups is available completely free of charge to provider groups, so it's easy to get started. Let's begin. Today's session is being recorded. All attendees will receive a link to the recording after the webinar, as well as the registrants who are not able to attend. Your microphones will be muted during the webinar. But throughout the session, you can communicate a question via the questions panel on the right side of the GoToWebinar desktop. Before we begin, I'd like to introduce the presenters today. I'm Mike. I'll be opening and closing the meeting. My coworker Taha on the product team will be taking us through a live demonstration, and Hannah will be backing us up in chat. We also have guests and attendees from United Healthcare, Superior, and other folks at CAQH. Thank you all for being here and for supporting this. Let's go ahead and get started. If you're involved in credentialing or enrollment for a delegated provider group, this kind of email is probably familiar to you. You send this month's roster to a health plan, and then you wait. Nothing. Did they get your spreadsheet? You send another email. Still nothing. Then maybe a phone call, another email, a week passes, another week, you get the idea. It's cumbersome and it's frustrating for everybody involved. So why does this happen? Let's take a look. Janet's the credentialing manager for a group of 800 providers. They have a contract with Aspen Health Plan to do credentialing. Every month, Janet emails a roster and a change report to Aspen. The roster has 25 columns and 3 tabs. It's a bit to juggle, but with a few post-it notes and reminders, it's nothing she can't handle. The problem is she also has to send rosters to Beach, Cypress, Dogwood, and Elm plans. Beach wants a PDF every 2 weeks. Cypress wants a spreadsheet monthly, but they require 4 fields that Aspen doesn't need, so Janet has to copy and paste. And Dogwood takes Aspen's spreadsheet, but they want it sent twice a month. No wonder provider groups struggle to keep up. The same is true on the receiving end, and that's why United Healthcare, Superior, and others have invested in this new approach, and why they're joining us today. All this back and forth causes a domino effect of bad outcomes. The first is that groups and plans spend an excessive amount of resources and time managing rosters. The processing is highly manual and can take months. The processing delays mean claim systems are out of date and inaccurate, which leads to payment delays, frustrated providers, and enrollment denials. Processing delays also cause inaccurate directories, which make it harder for patients to access the care that they need, so we probably don't think about it often. It's ultimately why we're dealing with these amounts of paperwork in the first place. All of this work isn't just a headache, it adds up to money. I've listed here some of the things that are necessary to reduce the time it takes to share delegated provider data with health plans. First is a standard roster format. The second is more transparency into the process, so you know what's happening to the data that you send to plans and when. It'd be great to have a way to check your information for errors before you send it out, and to do all this automatically without sending separate emails to each plan. And of course, when we're talking about data, we need to do it securely. CAQH ProView for Groups is an easier, faster, more accurate way to manage your delegated data. With ProView for Groups, you put all of your provider information into one standardized roster format that all participating health plans have agreed to accept. You upload your roster into a secure web portal, which is HITRUST certified, meaning it's HIPAA compliant. And when you upload your roster, the system performs more than 300 quality checks for things like duplicate providers and inaccurate formatting. These checks make sure your data is complete and accurate before you send it so that health plans can process it quickly on the other end. And speaking of plans, you can control which plans have access to your information, and you receive automatic notifications when those plans have downloaded it. And finally, but it bears repeating, CAQH ProView for Groups is completely free for provider groups. If you're not familiar with CAQH, you might be wondering how we were able to create such a big improvement. We've known it for years. We're a not-for-profit alliance that's been leading the industry to create shared initiatives that streamline the business side of healthcare for more than 15 years. On the screen, you can see our board members, which represent some of the biggest names in health insurance in the US. In total, we work with more than 1,000 health plans, hospitals, provider groups, and Medicaid agencies. And 1.9 million providers use our flagship product, ProView, to submit credentialing data. ProView for Groups is a natural extension of our credentialing offerings. Now I want to hand the controls over to Taha, who will show you how this works.
Wonderful. Thank you, Mike. Please let me know when you can see my screen.
I see it.
Wonderful. Thank you. All right, let's get started. Mike's going to be sharing the registration link via chat and email, but assuming that you have registered, set up your username, and you've logged in, this is the homepage that you would be viewing. Right off the bat, you can see a few certain things, such as you have about 345 practice locations, about 45 providers or so. We have a little bit of a menu bar at the top that's gonna, take us to different pages in the particular portal. We're gonna start off by looking at our group menu items. First off, we have the group details. I apologize about that. Let's just give it a few seconds to load. There we go. All right, this page basically contains all of the information that is going to be specific to your group. For instance, the group contact information, address, and then some medical identifiers for this particular group, such as tax IDs, NPIs, and some Medicaid and Medicaid IDs. And then you also have the opportunity to add a few more tax IDs and NPIs as you see fit. Moving on the Our Teams page, you have the ability to add or remove team members as you see fit. Moving forward, we're going to take a look at the provider section. So starting off, we'll take a look at the Add Providers page, where we have the ability to upload a CSV file to basically add providers in bulk to our group. Users will be able to download a sample file from here, and once they have uploaded the file, the system will show some metrics to them, such as, your file contained X number of providers. Some of them can be added, some of them cannot be added, and so on and so forth. This page also has the ability for you to see your previously uploaded files as well. Now, assuming that you have uploaded your file, you are viewing this error message that lets you know that you have the ability to basically fix the errors in the particular file and upload it again, or you can simply go over to the portal and you can fix these errors as well. Now, navigating over to the Our Providers table, let's just give it a minute to pop open. There we go. So we can see here that this is the place where we have all of our providers. We have a little bit of a table with some identifiers such as, their name, IDs, their authorization, their provider status, and their profile status. Now, this profile status is stemming from the previous page that we were just looking at when we went in and we added providers, but some of these providers had some errors. So just for that sake, I'm going to click on this particular provider, and I'm going to go ahead and I'm going to fix the errors this particular provider has. So this provider was previously in an incomplete status. We're simply going to go ahead and add in his missing fields. Required fields are filled out. I'm going to go ahead and click on Save. I can see here that went to turn to green from red. I'm going to navigate over back to our providers. I'm going to search for this particular provider, and we're going to see the status has been updated. So as we can see here, the provider is now in a complete status. Moving on, we're going to take a look at adding practice locations. Quite similar to the Add Provider file, we have a simple CSV file upload where we can go ahead and add practice locations in bulk so that users can have all of their practice locations into the system. Once again, once you have uploaded the file, the system will tell you some metrics about the file, and then you can either choose to accept the file and fix the errors in the portal, or you have the ability to download the error report, fix the errors, and upload it again. Quite similar to the Add Providers page, you have the ability to download a template and view previously uploaded files. Moving on, we'll take a look at our locations. Our locations, once again, similar to our providers, is in a table format where you have your particular practice location name, your address fields, the tax ID that's associated with that practice location, and the number of providers associated to that particular practice location. So just for these purposes, I'm going to go ahead and I'm going to click open this particular practice location. We'll take a look at some of these fields that we have that are more generic to this particular practice location. And we'll be able to see providers assigned to this location too as soon as this page loads up. Just bear with me, please. There we go. So you can see we have some generic fields about this particular practice location, the address, billing, mailing information, business identifiers, the accessibility fields, and the office hours. A little tab over here lets me know of how many different providers are assigned to this particular practice location. So as we can see here, this was the other provider that we were just looking at, whose profile has been is now in a complete status. So upon clicking this provider, I'm led to this particular page where I can see his provider at the details page. Previously, I was on the provider details where I could view different data attributes specific to this provider. This page is allowing me to view different provider at the location field, so I know what the provider's affiliation and is with this particular practice location. Moving on, we're going to be taking a look at the Hour Plans page. Quite similarly, this is the page where you're going to be going ahead and authorizing different health plans such as United Healthcare, Superior to access your group's data. Once you go ahead and you can simply authorize them to access your data, you can simply click on Review and Confirm. Now, what this step basically does is it allows all of the different health plans to receive your information. You do not need to go ahead and email a different roster file to each plan every single time. The health plan will receive an email that lets them know they have a new roster submission. Now, for example, the provider that I just completed earlier, his information will now flow through to the health plans. And obviously, lastly, if you're a group with non-delegated arrangements, you can always use ProView for groups to contribute location data to individual CAQH ProView provider profiles without needing to log into their individual profiles. The provider will only need to authorize your group once, and then you can update the location data anytime it changes. So that's all I had for the demo. Over to you, Mike.
Very good. Thank you. So I know that was a lot of information. Here's a quick overview of what we just covered. Once you register for CAQH ProView for groups, you will enter your group's details, tax IDs, and users, staff members, and things like that. Next, you're going to upload your providers and your locations. Once that data is in the portal, you will link those providers and those locations. This is that enrollment piece, a directory piece that goes with delegated credentialing. But this can all be done in the portal, or it can be done through file upload. In order to share that data with your plans, you will then select which plans you're delegated with and authorize them to access your data. Then, as Taha showed you, each time when you change the data and confirm it, that's when your plans are notified and they are able to come get it in real time. It doesn't have to be emailed. It doesn't have to be attached as a spreadsheet or a PDF or anything like that, or entered through some separate portal. So asynchronously, then they can come in and grab the data as needed. And as an added benefit, it can also be pushed into individual provider profiles. You will simply manage group detail data, request permission once from that provider. Once they authorize you, that data that you've just shared with plans for your delegated arrangements can also populate individual CAQH provider profiles. All right, I'm going to take a quick look for questions. I don't see any in chat. Moving on. So here's a summary of the benefits. First of all, we're talking about a single standard roster for all groups and plans. It reduces the manual work and delays associated with this work. Greater data accuracy and transparency. You're going to know exactly when a plan downloads your roster. There should be less back and forth email, phone call to confirm information because of the quality checks and data validations involved with this solution. Auto notifications also can help reduce the emails and calls. Security is ever important and increasingly important. It's secure data storage and secure exchange. Once again, it's available at no cost to provider groups. This is something that was developed in participation with provider groups and with plans, some of whom are on this call. It is, we think, a solution that's important for simplifying the administrative side of healthcare, and they are in support of it and encourage you to try this new methodology. So let's sort of wrap up with what happens next. If you like what you've seen today, getting started is easy. All you have to do is submit a short registration form using the link that I sent in the chat box. Once we receive your completed form, our team will email you a link to complete the process and help you set up your account. Then you're going to be ready to submit your next roster via the new CAQH ProView for Groups portal. Thank you very much.